Awesome. Thank you so much. My name is Lisa Chidzi. For those of you that have not met me, I am the family liaison for the Children and Youth with Special Healthcare Needs project here out of the University of Rochester. I'm one of many family specialist liaison positions for this project across New York State. And all of us also have a child with a special healthcare need. With me today is Mark Prinz. For those of you that do not know Mark, he is the community liaison out of the University of Rochester here, and he's going to be joining me today. He provides technical support for our local health departments with this project. So I just want to take a minute again to thank you for attending. I know it's a difficult time of year. And this is such a special topic for me personally and for us to share the findings with especially our families that participated. So I so appreciate your time, not only the first time when we spoke or you spoke to another family liaison, but also sharing some time again with us today. So I appreciate it. Just to let you know how this is going to go, Mark is going to review our background and some demographics around the study and the findings from our research. I'm going to review with you the lessons that we learned from the families, the main themes, and how we're supporting local health departments and current CYSHCN population at this time. We're hoping to get through this material pretty quickly in the first 20 to 30 minutes because we really want to spend some time having discussion, being able to answer your questions, and hearing from parents how things are going, comments and suggestions that you may have for us as we move forward with this project. And so Mark, I'm going to let you take it away with our background.
Awesome. So first I'm going to start out with a little background on Children and Youth with Special Healthcare Needs, the program. So the Children and Youth with Special Healthcare Needs program defines the population as anyone from birth to 21 years of age who is at risk for a chronic or has a chronic health condition, anything that requires general and related services beyond what's typically needed. You can see some examples there. It ranges everything from asthma to food allergies, seasonal allergies, hearing impairment, visual impairment, traumatic brain injury, cerebral palsy, all of those. Next. So the program is a state program that's implemented on the county level. Counties provide different levels of support through the program based on their local capacity, which includes staffing, size of the county, expertise. Many of the local health department staff that run the program are actually connected to other programs within their local health department as well. So a lot of them are part of the early intervention program, lead prevention programs, preschool. They're part of CPSE, CSE groups, things like that. But their primary role is to connect families to resources and services in the area. As a regional support center, our goal is to increase the capacity of local CYSHCN programs, children and youth with special healthcare needs, to better support the families across the state. We do this through education and trainings based on findings from the family engagement sessions, as well as local health department feedback. We also provide technical assistance and create space for local health departments to network, collaborate, and discuss their work. Just wanted to give you a visual representation of the state and how it's kind of broken up between the 3 regional support centers. As you can see, Strong Center for Developmental Disabilities, we handle the west side of the state. Westchester Institute for Human Development works on the east side, and then Einstein at Montefiore has been working in New York City and Long Island. So we conducted a number of family sessions, and I just wanted to give you a brief overview of the numbers. To summarize, between the 3 regional support centers, we held a total of 167 sessions, which represented a total number of 447 children and youth with special healthcare needs. And from those 447, they were represented by 339 either parents, caregivers, or we had a few self-advocates as well. A big thing to note too is that we were able to find representation from a majority of the counties that participate in the program. We also were able to hold some sessions in Spanish as well as Mandarin populations. This is a representation, a visual representation of the different conditions that were present when we conducted the family sessions. As you can see, autism was the largest at 31.6%. We also had behavioral conditions represented, which include things like ADHD, ADD, OCD, or ODD. And then we also had a lot of physical conditions as well, cerebral palsy, muscular dystrophy, GI issues, asthma, allergies. It's kind of a large group, but this kind of shows you kind of the spectrum that were represented.
Awesome, Mark. Thank you. So I'm going to spend some time sharing with you the main themes and findings that we learned from families and caregivers. The first and really by far, I think the largest theme was impact on the family unit. Challenges to obtaining a diagnosis were plentiful. Families really felt extremely overwhelmed, both emotionally and as well as medical knowledge, especially families that felt they had to make very quick decisions in an emergent situation. Parents also expressed feeling dismissed or a lack of empathy from a PCP or pediatrician that they approached about a concern for their child, and they felt that that put a strain then on that relationship and also further delayed a diagnosis or an evaluation. And parents also discussed a wait period to have an appointment either with a specialist or developmental pediatrician. Wait times varied anywhere from 4 to 6 months up to a year. And some of our families in more rural counties expressed concerns about the travel for evaluations and diagnostics, anywhere from 2 to 4 hours. The impact on a family is really life-changing. Families expressed many things about their family functioning. Finances came up many times. Mental health of that caregiver, of that child, siblings and family dynamics was mentioned many times from families. The ability to do everyday things, get to the grocery store, attend a birthday party, go to a parade, many of these things that families take for granted has now been changed for a family with a child with a special healthcare need. And two main things I want to make sure that we really shared that were part of this was childcare or respite, the ability to find someone that you trust, that you can really leave a child with and go and run errands and have a night out is very difficult for these families. And job or career advancement. So some of our families that had 2 incomes, one parent decided to stay home in order to have that time to care for that child, or they just wanted something flexible, part-time, and they sort of what's that word, Mark, forgotten that career advancement, right? They just felt like they could jump into that career like they could in the past. And parents and advocates was another huge piece here. Words are constant, exhausting. This was a full-time job advocating. Parents really feeling that stress of always having to constantly advocate and talk about their child's condition and make sure that child feels like they're a part of something and belonging and receiving the correct accommodations. I also had the opportunity to speak with several adoptive and foster families. This just added a whole other layer of complexity to an already complex situation for families. Definitely delayed diagnosis, definitely some underdiagnosis of trauma and mental health, and just those complex foster systems were very difficult for families to navigate. And all this really leads to parents struggling with balance, right? So parents really trying hard to manage those multiple obligations of just life and being and employment and all those roles we play in daily life, and balancing that with the time that it needs to care for a child with special healthcare needs. Our second main theme was accessing supports and services that came through our family sessions. Parents really talked about a wide variety of supports and services they access, both formal and informal. Formal is really around the school system, agencies, Medicaid and OPWDD, websites. The informal things that parents really talked about and really valued was the network support groups, other parents, families, and friends that are really checking that weight room, sorry, that are really those meaningful connections that they're making with families for support. The many barriers mentioned are where am I? Feeling of financial barriers, lack of personnel, and shortages across for support, lack of provider knowledge, and some geographical as well as some language barriers. Some of our families discuss language barriers to accessing support and services in those sessions where English was not your first language. Parents really talked about the education system being a challenge, concerns about placement, concerns about provider knowledge and really knowing their child and what their child needs, and also concerns about the future, which kind of leads into this next point about lack of transition services. Families were expressing a concern about transition services, not only within those education years when you're talking about transition in high school and, you know, getting out to transitioning out of high school, but also lack of transition services if your child is 18, 19, 20, 21, aging out of that school system, and what is really available for our young people with special healthcare needs in the community. Poor family professional partnerships was mentioned, not only within that education system, but also with healthcare providers, with agencies, with care coordinators, and of course the confusing and complex systems that we have here, right? So this is one of those preaching to the choir things that we sort of laugh about, but we know it's just so very difficult. The acronyms of the school system and the IEPs and the CSEs, and then the medical system and all those acronyms, and OCD and ADHD, and then OPWD and that acronyms, and then there's that mental health system, and these all don't talk to each other. So parents are quite overwhelmed. We had many families, and I think a couple on this call that expressed like, I should know some of this stuff. Like, I'm a social worker or I'm a teacher, and I'm having a hard time with this. And how are families that have no knowledge base navigating these systems? And really, we talked much about that in these sessions. Another theme, of course, was community integration. Our families are accessing the community with varying levels of success. Many families have expressed barriers to being included and feeling like they're belonging in the community. Some of our families that are finding success, we had several families that are in a small town or small community and really felt like everybody knew them and felt really embraced in their community. And those families that put that time and effort into a specific activity or event really felt like some of those were some of those great successes to celebrate. Our common barriers, our attitudes and understandings, families feeling like when they go out, and I know I've had this experience where you're feeling like someone's judging you by the way you're parenting or the way your child is behaving. And, you know, it creates a lot of hesitancy. Parents and families don't want to go out in the community if they're feeling like they're not belonging or they're judged. Also, a lack of supports or accommodations for their child, especially around behavioral, sensory, and physical barriers. If you don't know if they're going to be able to accommodate that large stroller or be able to sensory accommodate your child, it's very difficult to go out in the community and engage. Lack of offerings was also a big theme that came up in our sessions, especially for our rural communities, and also I mean, this was across the board as well, but also for our teens and young adults. Definitely those opportunities tend to dwindle as our children age. And then of course, distance, travel, and financial, again, barriers for accessing the community. Okay, so you thought we'd get out of this without talking about COVID-19, but here we are. This was really not a major theme of this project when this started, because this project started before the pandemic. But obviously, we're having these organic conversations with families and really started to talk, you know, fluidly about what are the impacts of COVID-19. And it just really exacerbated existing issues for families. Many of the barriers we talked about before, you know, increased isolation, school shutdowns, therapies stopping. It was really disruption to services and evaluation. Some families expressed having evaluation scheduled, and then it got canceled, and then it got moved to Zoom. And so there's really a lot of dynamics around COVID-19 that just put a lot of additional responsibilities onto parents and caregivers that are already stressed. So now parents are wearing that parent hat, and now they're wearing the therapist hat and the school teacher hat and the respite hat. And it just created a lot more anxiety for parents and children across the board. Parents expressed additional anxiety around worried about job loss because of having to stay home, during the shutdown, as well as worried about their child's regression. Child anxiety centered around, around friendships, isolation, and just being sick. Some of our kids were really, really anxious about being sick. And then, of course, this is just increasing the mental health concerns across this population. And as we know, we're seeing this across the state and I would guess globally. I haven't really read much of that, but across the United States, there's really a lot about the mental health of our young people and how we're suffering during this pandemic. There were some mixed experiences for virtual services. Some families said, wow, this is really great. Some said, oh gosh, no way am I ever doing this. And then there was a lot in the middle that were like, some days is good, some days not so good. 33% of our families were impacted, had their employment impacted in some way by the pandemic. And the pandemic did create some unexpected positive outcome for some families. Some families expressed the ability just to slow down as a family and spend some time together, and that just doing some activities. Somebody indicated that their child learned how to ride a bike, and some families which had the ability to kind of turn into that homeschool situation enjoyed being able to witness some of those therapies and watch their child interact with school personnel. So we have a quick survey for you. I know you're so excited. Another survey. There'll be several. No, I'm just kidding. Maybe one more. So Mark's going to put this in the chat for you. A quick survey. We'd like to gather a little bit more information on your thoughts really around the pandemic. What worked for you, or what you thought would have worked for you in the situation or our current situation. I know we're still sort of swimming through this right now. So what supports and assistance that you wish you had or did have and were helpful. So we're going to give you a quick minute to do that. Uh-oh, somebody got bumped out. I'm bumping people back in. Sorry about that. I think somebody got bumped out and I'm trying to put you back in. So we've prepared a song for you while you fill out the survey link. Mark is going to say, I'm just kidding, we haven't. I told Mark earlier, I told Mark earlier I was going to make him sing, and he goes, no, you're not. And I go, yeah, I'm totally going to say that. I said, and the funny part is we're going to be the only ones laughing about it because everybody else is on mute. So that's how this works. But now I'm not going to give people enough time. I should have set a timer. We're also going to, I'll also email out this link too for you to, if you have some additional thoughts that you wanted to add, that would be great. And did someone else get bumped out? Oh no. That's okay. I will send out the link. I'm sorry if it's not working. Sometimes it doesn't click through well in the chat. And I'm sorry if you got bumped. I tried to let people back in that got bumped. So prior to this project beginning, the Department of Health did some care mapping with some families and providers, and I think some local health departments, and came up with some of a list of top support needs out of that care mapping. And as part of our family sessions, we asked our participants if they could tell us what their top support needs were at that point in time, at the point of that family session or call. And as you can see, emotional and social supports topped out as the #1 need at the time, followed by assistance from the school system. And then the next 3 were pretty even: access to medical care. And access here was kind of all inclusive, not only just wait periods, but if it was far away, if they felt there wasn't providers close or not enough. So it was kind of a broad category. Financial support, and then community integration. So those 3 were pretty even. And then as we concluded our sessions with families, we really asked them if there was anything else that they wanted to share that they didn't through the conversation organically, or any specific recommendations that they may have for our program, or just to share generally. And these really all centered around these three words: support, opportunities, and training. Families really express the need for supports for the whole family, not just their child with a special healthcare need, but also for themselves as caregivers. Siblings especially was brought up many times, extended family, grandparents, really just feeling like they needed support for that whole family unit to help care for the child and themselves. Information and coordination between systems. We talked about how the systems are just crazy and very difficult to navigate, very hard to understand, even for the most savvy parents. So this is definitely a recommendation that came from parents. And this kind of led into this piece about accessible care coordinators, the word navigator, family navigator, system coordinator, where we kind of all sort of grouped into this recommendation of really needing somebody that's accessible, somebody that's knowledgeable, and somebody that can help families navigate those systems. Many families discuss the need for a guide, special hotline for a crisis or medical emergent situation, not just situations, but also those questions they have if they're an emergent medical situation and they just don't have the medical knowledge to make decisions. Families talked about if they're leaving the hospital with a child with a special healthcare need that they know at birth, is there a guide, a manual, something that talks about early intervention and all the supports and services and systems that are out there and available for families. Training was another big piece that parents talked about, and really lots of different trainings. Trainings for professionals and PCP providers and pediatricians to learn about all the different conditions. Trainings for educational professionals so they can better learn about their child and their needs. Trainings for the community members, trainings for themselves and family members, and also training for other children. That came up several times, that wanting other children to understand and be able to just be more accepting, and that sense of belonging for families. Of course, this leads into inclusive community opportunities. It's another big thing we discussed earlier, all the barriers that families feel when they try to engage in the community. There's so many benefits for families getting in the community, feeling a part of something, feeling belonging, giving enrichment for families and children. And so it's another big need for families. Addressing staffing shortages came up. So we got to do lots of brainstorming around that, right? So, and we know that this has been going on for a while. This isn't new. COVID has exacerbated this situation, but there's really staffing shortages across the board. Direct support personnel, developmental pediatricians, mental health. There's a lot of issues going on in the school systems now. Teachers, therapists, food service workers, bus drivers. We had lots of local situations around transportation here, lots of local situations around lack of teaching assistants and some of our high medical needs classes. So there's really a lot of work to be done in this area, and would love some brainstorming around how we can approach staffing shortages. And that also sort of leads into this last recommendation around mental health and trauma resources. There's been definitely for several years that I am aware of a lack in mental health resources, and it's especially felt in our rural communities. Many sessions that I held with some rural families are trying to do telehealth appointments for a therapist or a mental health provider. And so it's just really exhausting for families to either try to set that up via Zoom or try to be traveling several hours to get the mental health care that they need. So I'm going to switch gears pretty quickly and look at, or just share with you a little bit about the support that we're providing for families and local health department at this time through the project. And first off, we've tried to address a few of the research results thus far. We have more work to do in these areas, but we've tried to dive in here over the last year or so and provide some different webinars and educational materials, both to local health departments and to parents. So all of these are recorded and the slide decks are available. That CYSHCN website is a link at which you probably can't click on right now while we're live, but Mark will put it in the chat for you, and I will also be emailing that out for you. And of course, our real focus here is really on making connections. One way we're doing that is with this family forum. This is one of many family forums that has been held across the state. And I think they're also working on making sure we have some family forums for those families that participated in Spanish and Mandarin. We've been sending out newsletters twice a month to local health departments that has been providing resources both for professionals and health departments, but also for them to disseminate to families as appropriate. As part of this project, one of the tasks is a resource directory. So we have all been gathering local resources, and not only things that we're knowledgeable about, but also resources that families have shared with us, resources that health departments have shared with us. And the goal is for this to be housed on the New York State website and be really user-friendly for families and be able to find things that are local to your community and to be very helpful for that, for your child. Mark has been doing lots and lots of networking meetings with local health departments and really trying to bring people together and experts together and provide technical support to those local health departments for this program. And of course, making family connections. We want to connect families with resources. We want to connect families with the health departments, and we want to connect families with each other. And it's been so wonderful to see. I've had the opportunity and permission from families to connect families with each other and connect resources and share this one parent's social media group with another parent. And you guys have been so gracious and wonderful. And I think it's such a wonderful support to continue making these connections. We've had participants come back and present for the project and create webinars. So it's really been a wonderful experience to create those connections. So we're ready. Are you ready? We want to open it up, really spend a few minutes here with you, answer any questions that we can share thus far on the data or any of the findings. If anything was surprising, Mark and I just put together a few just prompts to help get you thinking if there's something that doesn't come to the top of mind. But we do have an extension on this project and are really looking for your input and to hear how you would like to, or what kinds of resources or ideas you have where we can move forward, make connections, future topics, all that good stuff, because we know you're all a wealth of knowledge and it's awesome. So you can unmute yourself if you want to talk. You can ask a question in the chat. We might have one already. Mark, are you reading the chat?
Yep. Sorry, I wanted to wait.
No, that's okay.
We got to this point. Lisa mentioned a few things. She was wondering who will see the impacts. This is so powerful. We parents know this information, but others need to as well. I started writing a response that part of the project has included write-ups to the state, kind of pulling the key findings and then giving examples of where there have been quotes about those findings in an effort to kind of help direct what is being done on the state level.
Yes, well, and local health departments are invited today, so we're sharing findings out locally, which is great. We did have the opportunity to present findings at the AUCD conference, and oh goodness, I'm trying to remember what that is. The University Association of University Centers, right?
Yes.
Okay.
For University Centers on Disabilities.
Thank you. I was like, oh, so that was really nice. It gave us an opportunity to present nationally. And we actually received some really cool ideas from other states that already have like a resource directory, for example, and see the kinds of things that other other states are doing, because this CYSHCN program is not just a New York State program. This comes federally. So there are federal dollars that help to fund these programs. It gets funneled through the state. And so this also is in other states. So it was really interesting, I think, I mean, even though it's New York State findings, to take it to a little bit of a national platform and hear what other states are doing. It was really cool.
So I have a question, if that's okay. So it just feels like the Department of Health handles certain things. The Department of Education handles certain things. OCFS handles certain things. And I'm on the New York State OCFS Parent Advisory Board, and I know there's going to be a meeting with all the, I don't know, deputy commissioners, I think are the titles, to try to become more coordinated with everybody's efforts, because I just feel like that is one of the biggest barriers getting services. Like you just get certified, like, I don't know, with OPWDD, but then there's definitely mental health stuff that needs to be supported. And so what's happening with that? Like, is that part of this initiative too? Because it seems like that's exactly what this should be. It should be like a conglomerate of all those services to better help support our special needs children.
Susan, can you invite us to that meeting? I think that's part of where we're trying to go is so this is clearly a recommendation and is clearly something we're hearing from families. And I also think, Mark, forgive me, I don't want to speak for your local health departments, but they also feel that, sort of like, we're trying to take a family and say, okay, well, here's OPWDD and here's the school, because they don't, you're right, they don't talk to each other. And so I think we have to bring all those partners together in conversations to build that collaboration. I don't know how else to get there without doing that.
Well, if you, what is your connection with OCFS? Do you have a particular, I mean, we could take this conversation offline and I could see if the topic would be something to bring to the Parent Advisory Board, because we're setting up our goals for next year. So if you want to reach out to me and we can talk further on that, that would be great. So, so the question, so the answer to that question is everybody's acknowledging it's an issue and hopefully there's something being done about it, basically. Or I know there is the deputy commissioner, but like they tell us, OCFS, it's a big ship, a while to get some movement. So, but our families and our children, we need immediate help. I'm just going to put that out there.
Right. Thanks for bringing that up, Susan, and thanks for being here.
There's a lot going on in the chat. So let me go back to it really quick and see if I can pull some of these.
I'll let you read it. Can you read it?
Well, one thing I noticed right away, Melissa, I agree, is how do we move from taking a picture of the landscape to changing these outcomes, which we kind of just are talking about now. Let's see here. Lisa asked if we're, considering sharing of this with any news organizations. The community at large needs to get this perspective. I don't know if news is where we're going to go with this, but we're definitely working on trying to disseminate this information and make sure that other people outside of this group have a more awareness of what's happening in their larger communities for sure. Let's see here. Yeah, the siloing of systems is definitely a barrier, and it's being mentioned several times in the chat. And again, we heard that a lot from parents, local health departments kind of feel it as well. Any of my local health departments that are on the call, feel free to jump in if you'd like to. We can get back to you on who to communicate with, potentially with the state. Lisa, I don't know if we have a formal way of doing that.
I missed the question, Mark. Communicating directly.
Alexia asks, who are we reaching out to on the state level? Can we also address concerns or issues with the state?
Well, I think that's part of what we're tasked to do as a resource support center with these family sessions is to get your input to the State Department of Health. So that's the goal of this piece. And then the interesting part, and I want to circle back with Susan, is then how are we getting the big people in the room to have conversation? Because that's how it's going to drive change, right? Yeah. Other questions, Mark? I'm trying to look at my two screens. I need two screens because I'm
sorry, I don't mean to ask so many questions,
no,
but
that's okay.
I mean, I just have seen the impact of the Parent Advisory Board on OCFS initiatives, including the Family First regulation that's going to be coming out. And has the Department of Health ever thought of, or this group specifically thought about putting together a Parent Advisory Board that has representatives? I think sorry, I was on a call earlier, but I was watching the slides that covers this side of the state. So you have not just your initial interview, but you have ongoing conversation with parents to follow up to, you know, I'm part of support groups, so I not only bring my information to that Parent Advisory Board, but I bring others, families that are struggling with severe issues. So then, you know, OCFS is taking that information and, you know, putting it into their thought patterns of how they're going to move forward and how they're going to do things differently. So have you guys thought of doing something like that?
I don't know if there's a specific parent advisory board. I don't know if you know this, Mark, for this project specifically. I know that so we as a resource support center has a community advisory board that is brought up of community partners and parents as well to help look at what we do as a university center. And that definitely helps inform the resources that we share through this project. So it's interesting. I don't know if there's one like across the state for Mark's shaking his head. You think no, you're muted. But I'm just not clear if there's one like connected group, if that makes sense. Does that make sense? Mm-hmm. Yeah. But I appreciate the recommendation. And again, that's something that we can bring back as we start to, you know, share these findings back. What the state has seen these findings, the Department of Health, and we can share back, you know, that as a recommendation as well. I know though, Mark, that some of your local health departments are part of different like community groups. So they're meeting with families. I just don't know if it's formal, Susan, if that makes sense, like a formalized across, you know, like across the board group of, you know, like a Department of Health advisory group. But I can ask and see. Let's see. Oh, I think we're getting some, what else are we getting? Some resources in the chat.
Liz Fox raised a new concern that she's been seeing that parents are being pushed into self-directed as opposed to care coordination and not being properly advised of the differences, then not getting any services because floating in self-direction. They don't know how to obtain what to do. So we'll definitely take note of that and put that into our. And then Melissa asks, what is the remaining scope of the project?
I'm sorry, I missed that. Did you want me to answer that? What did you say? I'm sorry.
What is the remaining scope?
Remaining scope of the project. So we have an extension for the project, which we're super excited about. And our goal is really to address some of these barriers through technical support to local health departments, building capacity, building connections between families and resources, additional educational materials and topics. And am I missing something? And we do hope to do some surveys of families that have already participated, just kind of as a check-in. And, you know, and this to me is part of this too. And I really appreciate, again, families being on and sharing concerns, suggestions, because that's, you know, again, I think what Susan, to echo what Susan said, I mean, this is how we make change, by coming together and, you know, having hard conversations about things. We have, Mark, we have a survey link, a feedback survey. So it's a way, if you have questions, if you think of resources that you'd like to share with us, or you're just not comfortable unmuting and chatting right now, you know, please do that. We always love to hear your feedback. You could also email myself or Mark if you have specific suggestions, specific resources that we can share with families or local health departments, you know, would be really, really super cool. And I'm happy to stay on. I think Mark is happy to stay on if people have additional questions or want to have conversation. We're happy to be here. Mark can sing for you again.
And thanks, Deborah, for this is one reason why it's nice to bring people together, is, you know, mentioning that Region 1 Facebook group with parents sharing a lot of their self-direction stories, it sounds like, and that you get a lot of help through Facebook. This is kind of what's nice about having a conversation, is we can share that amongst people. So, and Melissa, yes, capacity building would be best achieved by hiring parent partners, navigators, peers. That definitely was a recommendation that we heard from families across the state. And thank you, Alexia. We'll keep you in mind. And Liz, yep, good point. If they know where and what and how to find those groups, that's definitely, again, another barrier, is trying to figure that all out sometimes when you have other things going on in your life as a parent. So.
Thank you, guys. Thanks for spending time with us today.
It's good to see you all.